News 4 Sports with Dan Ryan.
Its use spans the NFL, the NBA, and it's trickling right on down to the high school ranks. It is called low-level laser therapy. And there are two high school athletes here in Tucson whose recoveries from serious knee injuries are nothing short of stunning. In the course of 3 years, medical technology has advanced another leap and another bound when it comes to sports medicine. Laser therapy is healing injuries at amazing speeds. Two South Point athletes can testify to that. JV basketball player Alex McAvoy and girls star Sybil Dosty. In the case of McAvoy, he broke a growth plate in his left knee.
I was playing basketball at the YMCA and I jumped up and my knee just snapped. And I was in the hospital for 4 days after that. And they told me I wouldn't play basketball. I'd be done for the season. And I was in a cast for 8 weeks and a leg brace. I was supposed to be in a leg brace for 8 weeks, but I was only in it for 2 weeks. And I started rehabbing with the laser. I mean, it just took me way ahead of schedule where I was supposed to be.
Dosty ruptured an ACL, most recently in her right knee. She began the season wearing a brace, found laser therapy, and the brace is gone.
And she was treated with the laser really very few times. I don't even think she received 10 treatments. And able to play without the brace, not having any problems. Her parents were thrilled, of course.
Rudnick sees this kind of recovery all the time, but it still amazes him.
The recovering time is dramatically better, 50% better, or maybe even 70% better. And the results have been astonishing because it is a serious medical device as compared to a light that's kind of a toy.
There is a day in the near future where laser therapy will be accepted at the college level. He knows one thing for sure when it comes to the Wildcat basketball team.
Isaiah Fox could have been back on the court. I mean, I have no doubt. If Alex could have been on the court, Isaiah Fox could have been on the court.
Well, David's a 61-year-old gentleman who's in the printing business, has been a diabetic since age 23, takes 2 insulin injections daily over many, many years. Again, his toes were cyanotic. There was extreme pain, inability to move the toes. The 5th toe had already been amputated. He had an amputation of the left leg in '99. He had a subsequent femoral popliteal bypass in an effort to establish circulation to the lower extremities, which was unsuccessful. So he's had a lot of surgery. And actually, when he first came to us 2 weeks ago today, was somewhat tired of living.
There was a tremendous hollow on my heel that had grown very quickly over 3 or 4 weeks to a monster size, almost my whole heel. And I could walk, but I had to walk on my toe, on these toes. Very painful, even walking on the toe. And there was quite a bit of pain just putting my foot down.
Let's break away from the treatment for a moment. Now just lift your leg up. Yeah, well, the ulcer in the heel is substantially healed. We've got a little ways to go, and the ulcers on the bottom of the toes are totally healed, and pretty much on the anterior tibia as well. Yeah. What's the temperature of the foot?
It's actually warmish.
It's warm. Yeah.
I don't. To be honest, I can only tell you that it felt cold. I don't squeeze my foot too much.
Yeah.
It felt cold for the longest time, but now I've got some feeling in it.
By radiating with the laser over the terminal spine, the nerve roots, you get dilation of the arteries to some degree. Over long-term treatment, there's the formation of new arterioles, capillaries. So you improve the blood supply both by treating over the nerve roots, which control the vessel diameter, and also treating the tissues locally. So we use a two-way approach with these types of situations. And out of the 4 ulcers on the toes, all of them have healed in 2 weeks. The 3 on the anterior tibia, 2 have healed completely, and the other one 90%. And the ulcer on the heel on which he still walks has diminished in size by 70%.
I moved my toes a while ago. Sounds like nothing to you, but to me it was something.
How you feeling today, Winston?
I'm fine.
That's great. Let me just get this set up for you.
Every day is better.
Winston Freak is a 50-year-old gentleman who has an established diagnosis of Berger's disease, also known as thromboangiitis obliterans, which means the small vessels and the arterioles become obliterated due to an inflammatory sort of disease process. And this causes lack of blood supply to the extremity. It causes severe pain, almost intolerable. These people can't sleep. The tissues become rigid, cold, and they suffer to a marked degree. He had a similar problem with the left leg a year ago, which resulted in amputation. And the right leg, when he presented, was cyanotic, at least the forefoot and the toes, icy cold to the touch, and relatively rigid. And you realize that the critical phase now is gone with regard to losing the leg, which I'm very pleased about. And I see your toes are relatively pink, and your foot feels nice and warm, and all of your ulcers is healed with the exception of one small one, which is about, I would say, 70% improved.
Well, when I came in, there was no feeling at all. You know, no feeling whatsoever. Foot was black. And like I couldn't do any exercise, I couldn't do nothing. This was about a month ago.
Winston, just let me know if you have any pain.
This was the same thing happened. I lost his leg. So I didn't want to go through this again, so I was hoping that this would work, and I'm quite happy.
I'm very pleased with the progress you've made, and I think this is somewhat historic to be able to save legs of this caliber.
Thanks to you.
Well, thanks to you for being a wonderful patient.